once the vaccines came out, that's when things got interesting and our hospitals were overrun. These massive heart attacks in young people coming in with myocarditis and pericarditis. We had people already on blood thinners who would come in with these massive blood clots in their legs, their lungs, in their brain. And the only thing that this patient did differently was they took a COVID shot. I'm being blocked from educating my fellow healthcare workers, filing reports. And so I'm saying, are these things really safe? Because how do we know that if I'm not allowed to report these safety issues? We're dealing with a crime here. This is fraud, right? We're billing for these vaccines. We're billing the taxpayers for these vaccines. And as a condition of payment under the program participation agreement that every entity who was giving out these vaccines signed with the CDC, it says as a condition of payment, you will report vaccine side effects to VAERS under the EUA. So for every vaccine they billed and they didn't report a side effect for, that's a false claim. That's a lie.
Welcome to the React 19 podcast, where we bring awareness and support to the COVID-19 vaccine injured and discuss the science, research, and laws that affect all of us. Hi, everyone. Thanks for joining us again today. I'm Ann Forty, the host of the React 19 podcast. And today my guest is Deb Conrad, someone whose work must be amplified through the public square. Deb was recently featured in the award-winning documentary, Follow the Silenced. And in the film, Deb shares her story of being a very well-respected physician's assistant at a New York hospital where she was fired for simply following the law and reporting COVID-19 vaccine adverse events. She has filed a lawsuit against Rochester Regional Health for damages and for failing to report those events, and is here today to share what led up to that lawsuit and where things are at today. Deb, thank you so much for being here today.
Thank you so much for having me.
Well, to everyone listening in, please make sure you stay tuned to the end, because Deb will be providing information that you really need to know and that needs to get out, as I said, into the public square, which includes sharing her story, this information, and her lawsuit with lawmakers, journalists, and medical professionals that you may interact with, including friends and family, because the goal here is safety. Deb's story is one that should leave everyone in this country reeling because of its staggering long-term consequences. So Deb, as we begin, I would just like to share kind of your background and let everyone know that you have been a highly respected professional in your field. To note a few highlights here, you were the Director of Advanced Practice Providers. You oversaw credentialing, competency, education, compliance, and consistency of services. You were on the Medical Executive Committee that oversaw COVID crisis and set up policies for the hospital. In 2020, you were recommended to serve on the New York Society of Physicians Assistants Office of Professional and Medical Conduct. In 2021, you were given a Physician's Excellence Award by the Board of Directors as one of their most excellent people in the entire system. Obviously, those who worked with you and those in your community trusted you because they knew that you always put the patient first. And I thank Warner Mendenhall for all of those, sharing all of your awards and whatnot, because that he mentioned all of those in a recent interview that you were in. And he is the one who's obviously doing your case, and I'm so glad. I just can't wait to get into it. So let's just start there. If you would take us back to the beginning of the rollout, what you were thinking, what you were doing at the time, and then what unfolded.
Sure. And yeah, I appreciate Warner so much, because every time him and I do a show together, I always seem to forget to say those things. And he always reminds me about all of the things that I did in my career and the awards that I received. Because
I think
obviously I'm not a very boastful. I'm not a very boastful person. I forget about those things, but he always.
But what comes through, what has come through in all of the work that I've seen from you is your commitment to the patient And because of your strive for excellency in providing excellent patient care, um, uh, ironically, that led you to being fired. So you just, again, take us back to what was going on at the beginning of the rollout.
Sure, sure. So obviously, I was a hospitalist PA, so I worked in the hospital for most, if not all, of my career. I also did some outpatient primary care type of work, but most of my career was spent in a hospital setting, taking care of inpatients, admitting patients through the emergency room. And I worked through the initial phases of the COVID pandemic in 2020 up until, when the vaccine started coming out in December of 2020. So I was able to see everything from the start and then obviously through to the end, and also had a long career of knowing what patients generally come into the hospital for and how things like strokes and heart attacks and blood clots usually proceed. So I had a lot of experience behind my belt to be able to see these observational changes that I saw when the pandemic hit and then when the vaccines came out. So in December of 2020 is when these we call them vaccines,
Right.
but really, I'm not really convinced that these things were ever are have been
It's
vaccines, right?
countermeasure.
So yes, a countermeasure. So I want the audience to understand that
Right.
I do understand the issues surrounding this. So in 2020 of December, the vaccines first came out for our elderly and our nursing home patients, and then some healthcare workers. Back then, there was a lot of talk about these freezer requirements. So,
Right.
in order for us as healthcare workers to receive a vaccine, we had to go about an hour away in our health system to get the vaccination. And then we had to go back to that same facility. So initially when they came out, I said, no way am I driving an hour and a half to get a vaccine that's brand new that I know how it's going to affect me. I'm going to wait, to kind of see how this whole thing rolls out.
One
Because
point
at
I want
that
to make here,
point,
though, is
yeah,
I mean, you have said in the past you've always been, you never questioned vaccines before this. You were
mhm.
vaccinated, your kids were vaccinated. So it's not like you were coming into this like, oh, I'm not touching that. It was like, okay, I'm just not sure about this, but you never had a question about it before.
Right. No, I mean, did I question things like why do we give kids so many vaccines at
Right,
once? And certainly, but never to the point that I thought there was anything dangerous or
right,
nefarious or whatever
right.
going on. I'm a very reasonable person. I think about things before I do it. And this was one of those things that I just said, you know what, this is a brand new technology and that. And I'm
I'm just,
not
yeah,
willing to go out of, an hour and a half. And then what if something happens to me? I'm going to be an
right,
hour and a half away from home. And then I got to go back there. And I said, forget it. I'm just going to wait.
wait,
And at that point, there were no mandates. There was no push.
right.
It was just, we're going to start getting this thing rolled out. And so, okay. So I waited, and right away after they started vaccinating our community, nursing home residents and some of our healthcare workers that were lining up to get these things, all of a sudden we started seeing weird things. And it's interesting. One thing people don't realize during the initial waves of the pandemic, there was this whole that hospitals are going to be overrun and hospitals are going to be, just overtaken by sick people from COVID. It really wasn't that way. I mean, many times our hospitals were not full during the initial phases of the pandemic before the vaccines. But once the vaccines came out, that's when things got interesting and our hospitals were overrun. We were overrun with all kinds of weird situations and sick people coming in. When COVID was going on, yeah, we had sick COVID patients who happened to get hospitalized and were in the ICU. But other than that, nobody was coming into the hospital. They were all
Right.
staying home because they were afraid to utilize healthcare services. So many of our patients were just kind of COVID patients at the time, and we were otherwise not very busy. We weren't doing angiograms, we weren't transferring people. So when the vaccines came out, we became overrun with sick people. So one thing I noticed right away after people were getting vaccinated is they were coming in with COVID very shortly afterwards. So you've got the media yelling and screaming that no one's going to get COVID if you get these vaccines. COVID ends with these vaccines. This is how we're going to get through this pandemic. But yet observationally, I'm seeing just the opposite. I'm seeing people coming in who just received vaccinations and now are coming in the hospital with COVID. They're not outpatient. These are people that need hospitalization, which is not what's supposed to happen after you get a COVID vaccine, or at least what they told us right at the time. So that's right away, I was like, whoa, something's not right here. These things are not doing what they're supposed to be doing. That led me to then, try to figure out, what do we do? How do I make people understand that something's not right? And that's kind of where I started going online, and I discovered the VAERS system, the Vaccine Adverse Event Reporting System. Never had heard about it, or was there any mention about it from my hospital organization, even from the media when these vaccines came out. It was just, these are the solution to our problem. Basically, get it.
It's really interesting in that, pretty much everyone I've interviewed, including people like the co-founder of React 19, Joel Walskog, Danny Baker, who was a nurse, Michelle Shelley, who also a nurse. They never heard. I mean, these are people who'd been in the medical system for, working in the medical field for 20 years, and they had never heard of VAERS. And you would have thought that at the beginning of this rollout, where everybody's like, oh yes, don't worry, we're gonna, check every box, we're gonna be following up, we're gonna be doing this, that nobody knew of VAERS. I mean, it was just shocking.
Using a novel technology that we had never used on humans before this.
Right.
I mean, as far as for vaccination technology. Yeah, and you would think safety would have been the forefront, right? Before we started injecting people with, at the time, this was an experiment, right? Emergency use authorization is experimental.
Right.
And it's just a fancy word for experimental. And so safety should have been priority. And I said to myself, how come I didn't know about this? Why didn't anyone talk about VAERS? Again, at the time I was thinking, wow, nobody else knows about it, right? Like my administration doesn't know about it. Nobody knows. I must have, come upon this discovery. And so I started reading about how to report, what are we supposed to be reporting? And COVID-19 infection requiring hospitalization after vaccination was one of the requirements under emergency use for VAERS. That was healthcare workers are required by law to report COVID-19 infections requiring hospitalization of VAERS. That was one of those required, along with lots of other things like death after vaccination. Again, no time frame, because at the time, this was an emergency use product. We didn't have long-term safety data. We had very little short-term safety data. So a death after vaccination was reportable. Heart attacks, strokes.
Yeah, because you saw
all kinds of things.
When you said you saw all these weird things, I mean, talk about those things that you were seeing, the blood clots, the arrhythmias, the, people shaking, all of these things that you saw.
Yes. So, the most bizarre things that I had never seen in my career. Take the blood clots, for instance. Many of the people who came in with blood clots were already on blood thinners for some other condition. So let's say they had a heart arrhythmia, atrial fibrillation, and they were on Eliquis or Xarelto or Coumadin or one of these blood thinners to prevent clots. In my 20-year career, the only people that I would see coming in that would develop blood clots on top of that would be very unusual circumstances. So somebody with advanced cancer maybe, or someone who had some major trauma to their body, physical trauma, and then couldn't move and then developed a blood clot. But again, that was extremely rare. I mean, I could count on maybe one hand, one finger, how many people I saw in 20 years that it happened to. But all of a sudden, after these vaccines came out, we had people already on blood thinners, and I'm not talking an aspirin, I'm talking full blood thinners, who would come in with these massive blood clots in their legs, their lungs, in their brain. I said, what in the world is going on here? I've never seen this. And the only thing that this patient did differently was they took a COVID shot. So that's where I started to kind of put the pieces together and just say, this is strange. And often the patients would tell me, Deb, Everything changed for me after I took this vaccine. The patients knew something was different. I didn't even have to come up with this theory because they would tell you something went wrong. They know their body, they know how they were beforehand, and that was the only thing they did different. So things like that, these massive heart attacks in young people coming in with myocarditis and pericarditis, who again, nothing else changed, but they received one of these vaccines. And they would tell you shortly after I started to feel ill. I wasn't feeling ill before, but shortly after I took this, everything went downhill. Or we had lots of people coming in right from the vaccination centers. So the ambulance, we would see them all the time. There was a pharmacy that was right across the street from one of our grocery stores in town. And it's funny, that's a very busy section of our town, our small community. You would see ambulances at that pharmacy all the time. I had never seen ambulances at pharmacies before, but these people were getting vaccinated and passing out and all sorts of things. And people would say, oh, but how do you know they passed out from the COVID vaccine? Well, our pharmacies have been vaccinating for flu and all sorts of things before COVID. I'd never seen ambulances there before. So I knew this was the COVID vaccine. And they would come into our ER. I passed out. I couldn't breathe. All kinds of, my heart started racing. I started feeling very anxious. I became confused. And they'd come in right from the vaccination center. And still people would say, has nothing to do with the vaccine. What? That is a reportable event. They required emergency services and in many cases were admitted to the hospital. So it's like, what are we doing? Yeah, it's crazy.
So you're seeing this, and then you start reporting these. Explain how that happened, how you started and how you encouraged others to, and how all that unfolded.
So I'm a very inquisitive person. And again, the patients were looking to me for some sort of help, guidance, because they were experiencing these things and they knew it was from the vaccine. So again, I started doing these reports myself. I went on the VAERS website. I read all about what we're supposed to be doing. And then I, with no training, started filing reports myself. And it was an extremely difficult task. I cannot tell you how many patients because the system times out on you if you take too long on a page. It'll sometimes delete your entire file. So through trial and error, I learned how to navigate the system. And I think most people would have given up, honestly, but it became such a passion of mine. And I went to my leadership, my local leadership in the hospital. This was not yet at the system level. I went to my local, CMO, my chief medical officer, and my direct boss, who was the hospitalist director. And I said, look, this is what I'm observing. This is what I found we're supposed to be doing as a hospital system for our patients. So I'm going to start doing it, but I think we need to come up with a system and we have an education. Because again, I thought I discovered this, right? That I was the only one and no one else knew. And so I said, we need to come up with some sort of plan because that's what I do for a living as the advanced practice provider director and on the medical staff committee is I help with policy and change in the hospital and improvement of safety issues and whatnot. So I said, I'm going to start filing these. I'm going to put envelopes in the emergency room and in our fax track, and I'm going to notify everybody that I can that we're supposed to be doing this for safety reasons and because we're required to do this by law. And so at first, everybody was on board. Now, did anybody want to do it themselves? No, because again, it's a very awful system. It's very time consuming. Nobody has time. Nobody's getting paid. So no one wants to do it. So they're like, you know what, Deb, we'll give you patients to file and you can go ahead and do it. And I did that for about a month or so afterwards. And it just got, again, full-time job for me. My days off, that's all I would be doing is filing these reports, calling patients back, calling the CDC, talking to the VAERS people. And I just said, this is ridiculous. So I went back to through this whole process, I kept notifying leadership and saying, we need to come up with some system. We need to do something here.
Because that's your training. You're all about, let's put things in place to keep the patient safe.
Yeah. And I just kept getting no answers. And I went back and I said, look, we have got to do something. I can't be the only person doing this. So what happened is my chief medical officer said, well, you know what, let me talk to the system and let me see if the system is seeing the same things you are, and what are they doing about it. So she contacted our system leadership, which again, our hospital system encompasses 9 hospitals and like 500 outpatient clinics, 5 nursing homes. It's huge.
Wow.
And what happened from that talk, that discussion, I don't know, other than I received an email that said they want to audit you. So I said, well, I knew what was going on. And I'm like, no, I cannot be the only one seeing this. So I came up with the exact perfect patients to meet those requirements. So when on the VAERS website, it had specific requirements for what we're supposed to be reporting. I picked exact patients that met those required reporting requirements, and I submitted them as part of that audit. I wasn't there for the audit.
Right.
I don't know who was involved, but basically the end result was, yeah, you're the only one seeing this. No one else sees it. We think you're over reporting. So as a result, you're only allowed to report on your patients that you're directly taking care of. You can no longer report on any other patients that you're not taking care of. And basically they're like, you're going to, they took the envelopes down from the ER, and they basically said, you can't talk about this anymore. This is just your game. And I'm like, no, this is not what we're supposed to be doing. Like, this is a safety issue. What are you talking about? And I said, well, what's going to happen to all those patients that no one else? Well, the providers, it's their responsibility to educate themselves. We're not going to educate them on this.
But
And I
all
said,
they've been
well, no, you're
told,
supposed.
all they've been told by the CDC, oh, it's safe and effective. There's Peter Marks, there's Janet Woodcock, safe and effective, Fauci, and plus, well, we don't need to go into the incentives of the hospital, but there were incentives to get people vaccinated, and at any rate, that's another rabbit trail. But yeah, that's all anyone was told is safe and effective. And if something happened, it wasn't the vaccine, as you've noted. Oh, you're just stressed, you're just having anxiety, whatever.
Mm-hmm. Then it came down to you're an anti-vaxxer, you're one of those anti-vaxxer people, and I'm just like, no, I'm just trying to report the safety issues that we're supposed to be reporting. And I thought I was going mad, right? Because I kept I can't tell you how many emails there were of me sharing screenshots of the VAERS website and exactly what it said. And I'm like, I'm not crazy. This is what it says we're supposed to be doing. And I would talk to the people at VAERS and I'd say, listen, my health system is telling me not to do this. What am I supposed to do? And they're like, you are supposed to do it. Okay, well, who's going to tell them, because they're not listening? And then I called the New York State Department of Health. I called our accrediting body for the hospital, so our DNV, which is they accredit hospitals, because of course I reached out to the FDA and I spoke with the director of consumer affairs for the FDA. And he said, well, the hospital has an accrediting board and they're the ones who, should be getting on this whole VAERS thing. Okay, great. So I contacted them again. They knew nothing about it. I don't know what you're talking about. We're not responsible for that. I just kept getting in circles. It was insane. And, and a part of me was like, you start questioning things and you start saying, am I wrong? Like, am I doing something wrong?
All the while you're seeing patients continuing to come in like this.
Yes. And I just keep reading, this is what we're supposed to be doing. I'm like, no, I know I'm not crazy. I know this is what we're supposed to be doing. And just kept getting gaslight. Well, again, I became more and more and more vocal about it, more and more passionate about it, because I kept asking them, okay, so these patients that I can't report, what happens to them? And they're like, well, you can put it in the internal Safe Connect system at Rochester Regional Health. So if you think there's a provider that's not reporting side effects, you can let us know about it and we'll take care of it. And I said, well, I have done that. And I've received no feedback. What is the plan? Are you going to reprimand these doctors and PAs and nurses, or where does it go? Not for your business. Like, we're none of your business. I'm like, no, it is my business, because if I know this is going on and this is a by law requirement and I do nothing about it, I'm a criminal too, right? I'm an accomplice to a crime because I know it's going on and I'm just sitting back and saying, sorry, not my problem. No, I'm not going to be part of it.
But you know what? That's what everybody was doing. It was just, no, I'm just doing what I'm told. Nope. Oh, it's not the vaccine. Nope. And everybody's, and the damage that has caused.
I know. And it's insane because to me, everyone was like, no, you don't understand, Deb, this is a crisis. This is a pandemic. We got to get out of this. I'm like, this is when you have to be vigilant. You have to be on your toes and be aware that maybe everything's not going to go the way they're saying it is. We're still independent minds and we're an independent hospital. We don't just sit there and take directives from a federal, the CDC and the FDA. These are not people seeing patients that we are. We still have to have independent thought. We can't just, but everybody just in lockstep went along with what the television and the media and everybody was telling. I'm like, what is the matter with you people? We don't do this in medicine. This is not how we practice medicine. Yes, there are some protocols and things that we follow, but you still have independent thought. You treat the patient in front of you as an individual. And it was just absolutely insane. And so as I kept becoming more and more passionate about this, there was more and more pushback from the system in the sense that that's when the threats started happening. You're spreading vaccine misinformation. You can't talk about this. There were patient complaints. I kept getting pulled into administrative leadership meetings where I was reprimanded. I was told we are supposed to toe the company line. We work for a system, all kinds. And I'm like,
so basically,
I really don't care.
Yeah, you were being told, hey, we have to do what the company's telling us to do. So just get in line and just trust the FDA and CDC. This is what they're telling us. Just trust us and toe the company line.
And I was like, no, because that's not what I'm seeing. What they're telling me is happening is not what I'm seeing clinically. And my job as a healthcare worker is to first do no harm. That is what we were taught from the beginning of our training. That's the oath I took. And I'm seeing harm being done, and I'm not shutting up about it. I refused. And so as time went on, I obviously knew I was in trouble and my job was going to be on the line. So I was reaching out to people, obviously, that were coming out speaking like I was, trying to make connections. And I made connections with someone who was directly connected to the Siri and Gilmstead law firm, which is Aaron Siri and Elizabeth Brem. And then they said, you know what, Deb, we will help you. We will help you as you're going through this process. So I had somebody to help me stay within my legal means. I didn't know what I was doing. They're telling me that, what I'm doing is wrong and I'm crazy. And I'm like, no, but we're dealing with a crime here. This is fraud. Right? We're billing for these vaccines. We're billing the taxpayers for these vaccines. And as a condition of payment under the program participation agreement that every entity who was giving out these vaccines signed with the CDC, it says as a condition of payment, you will report vaccine side effects to VAERS under the EUA. So for every vaccine they billed and they didn't report a side effect for, that's a false claim. That's a lie. That's fraud. So, and again, I knew all
the hospital would have, in one respect, would have wanted to cover them, do the right thing because there's a penalty, like, what is it, $13,000 for every?
I think it's up to $27,000 for every violation. Every violation, meaning every bill.
Can you imagine the reality if the amount of fines there would be if what took place, what should have taken place actually would have taken place? I mean,
exactly. And so, and just before we got on this call, I looked it up because one of the things I can say throughout this experience was that every time I looked up how is vaccine safety monitored in the United States? How do we know when to pull vaccines off the market? It kept coming back to VAERS. That is the main system that the CDC and the FDA claim that they use to assure
nobody's using it. Nobody knows about it. Nobody uses
that vaccines are safe. And so yet I'm being gaslit and I'm being blocked from educating my fellow healthcare workers, filing reports. And so I'm saying, are these things really safe? Because how do we know that if I'm not allowed to report these safety issues? And again, people think, and this is what I got a lot from my colleagues. Well, Deb, how do you know the vaccine caused it? And I said, I don't know. That's not my job. My job is just to report what I'm seeing.
Right.
Right. And the required reporting is clear. If a patient gets a COVID vaccine and they're hospitalized, that's a reportable event. So I'd get somebody who got a COVID vaccine and a week later are in the hospital with massive sepsis or a blood clot or a heart attack or whatever. That was a reportable event, because the only thing these people, then again, patients will tell you that's the only thing I did different in the last week was I got a COVID vaccine. Okay, what else am I going to blame it on?
Right.
You know, we've got a new product on the market that people are taking. And yes, you know, people will say, well, before this, Deb, we would say it was their sleep apnea or it was what, you know, okay, but we didn't have those things to blame it on.
Right.
There was nothing else they did different, right? So, and I just kept telling my colleagues, just because you file a VAERS report doesn't mean you're saying the vaccine caused the event. You're not an anti-vaxxer because you file a VAERS report,
Right.
but that's how they made you feel, that
Because
you
you
were an
couldn't have,
anti-vaxxer.
I mean, you had the whole, I mean, the larger backstory to this is, you know, you had the whole Trusted News initiative where they were all banded together saying we're not going to let any negative thing come out on the vaccine. And of course, then you had the Biden administration working with social media companies to shut down anybody who was reporting anything negative. I mean, I'm not vaccine injured. I was just sharing stories of the vaccine injured. I was shut down, you know, Facebook, but the vaccine injured themselves were all shut down. So no one could speak. I mean, well, you could speak, but no one was going to hear you because of all the systems in place. And it was so ingrained that these were safe and effective, which is mind-blowing to me, because when you think of a product that's never been used, people say, oh, it's been tested for 20 years. It's still, but it had failed and it had never been used. And Moderna had never even brought a vaccine to market before. And you're going to put it out on all of these, and we're not going to follow up on everything. It was just, it was literally crazy. But that's what happens when you silence speech and you create fear. They could control everybody. Just, oh, you know, fear, 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 and then don't let anything else come out. Unbelievable. What's really remarkable is that you had the courage to just not fold. That you, I mean, I know everybody else. You think of how many people were scared that they just got the vaccine. You know, that's what led them, even though, you know, nobody's supposed to be forced or coerced into taking a, you know, a product, but yet, well, if you don't, you're going to lose your job or, you know, whatever it's going to be. So you have people that are so afraid that they're willing to inject this into their body. And then, of course, they don't want to lose their job for agreeing with you or sounding like an anti-vaxxer or whatever else. But here you were, you're just, hey, I'm just about safety. And you get fired.
It's insane, right? And again, the fact that no one, I mean, don't get me wrong, there were people on the side in silence that agreed with me and that would talk behind the scenes. But again, everybody was so afraid to speak about this. And I've never in my career had anything like this happen where we were silenced for talking about an adverse event of a product or an observation that we were seeing. Before all of this, I mean, if we had a new drug that came on the market or a new procedure and we started noticing that it was not doing what it was supposed to be doing, they'd want us. It would be a crime if we didn't bring it forward, right? But this all of a sudden, it was like, no, you cannot speak anything but that this thing is safe, effective, and is going to get us out of this mess. And I'm like, this is just insane. And yeah, I don't know what gave me that clarity. I mean, people ask me that all the time. Again, I'm a very faithful person, and I believe that you know, not that I wouldn't stand up anyway, but I mean, I had my faith behind me. I just knew this was the right thing to do. I mean, this is just, it's counter to everything I've ever stood for.
And it really permeated through your whole career, which shows in your awards and how the community, you know, trusted you. I mean, it just was who you were.
Right. It's not like and that's what I kept saying. It's not like I'm doing anything I've ever done differently. This is who I've always been.
Right.
And all of a sudden, now I'm not like looked up for it. Now I'm thought to be some crazy person because I'm standing up. This is insane. It's just insane. And then, you know, I guess, you know, during that time, the good thing about it is it prepared me for the mandates, because during this whole, you know, we were being pushed to get vaccinated, but we weren't at that time being forced. But then when the mandates came down was when really I went over the top as far as like that just triggered me even more. Like, wait a minute, you're blocking me from reporting safety issues on things that I don't think at this point are safe for anyone to get. And now you're going to force it on society and kids and adults and what? I mean, that's when I really lost it, because I'm like, no, now you're directly harming people. Now this is like, people don't have a choice now. You are directly, purposefully harming people. You know this is happening because at this point, Aaron Siri had written legal letters to the CDC, the FDA, everybody got these, the hospital, about what was happening, what I was seeing, what was happening. Everybody knew. And despite that, the mandates went through. And I just said,
yeah, I mean,
how do I not? This is nefarious now. This is an evil plan. And I said, this is the hill I'm going to die on. I don't care. I don't care. I am not putting this in my body. I am not.
And to your point, in January of 2021, the NIH was flying vaccine injured out to the NIH to study them because they were aware of thousands of injuries that were taking place. And they're flying, I mean, Bree Dressen, another, the co-founder of React 19, she was flown out. Others were flown out. They were promised, yep, we're going to let the public know what's happening. Just, for now, just stay quiet. We want to, get this all under control, and, we'll help you and we'll let the public know. And nothing. They were silenced. They were ghosted. I mean, and then they mandate it, knowing all of this.
Yep.
I don't know how
it was.
Like, how do we let the world? How does the world just not wake up to this? And just,
I don't know. And fortunately, the strength that I had gave a lot of my colleagues strength. In the sense that they walked away from those mandates. As hard as it was, they saw me as that leader to help guide them. And I was having meetings in my barn of people coming from all over Western New York, basically to try to support each other of what we were going to do when we were going to, lose our job, so to speak, because we knew, right? We knew that the mandates were coming. Well, for me, obviously, I was fighting for a different issue. I was fighting over this VAERS situation, but the mandates were coming. And I ended up going on Del Bigtree, the High Wire, and a podcast with him. I believe it was September 17th. And that's when I disclosed what was going in the hospital with the VAERS. And I said, this is why I'm not getting vaccinated. Right. Like,
right.
I'm not taking this vaccine because I'm some anti-vaxxer person, like that they make you out to be. Right. I have reason to believe these things are harmful of what I'm observing. I am not comfortable putting this in my body. Whatever. So that's what I just kept saying. Like because of what I'm seeing, I cannot do this. I cannot do. And no one should else do it either, because
they at least should have informed consent at the very least, which was I was fighting for in my community. I'm like, okay, well, I know they're not going to stop the shot, but any medical professional that's giving out the shots should be saying, oh, by the way, if you do have an adverse reaction, nobody's going to know what to do with you. Nobody's going to believe you. The government's not going to help you because the CIC claims, 97% are rejected. You're going to be completely abandoned. You're going to lose your job. You're going to lose everything. But, if you'd still like that vaccine, here you go. And at least people could know ahead of time, but there was nothing.
Absolutely.
There was nothing.
Absolutely.
So how do we get to the lawsuit? How did that unfold?
So ultimately what happened was, I did this podcast with Del, and then I also did a piece for the New York Times. And it was after that.
The New York Times?
It was just like the New York Times.
That's pretty
they
shocking.
Did. It was more about the mandates, but I did say in there, the reason I didn't want to get vaccinated is because of the side effects I was seeing and the VAERS issue. And so then shortly thereafter, on October 6th, I was walked out of the hospital. Middle of my shift, I had come back from lunch, was surrounded by human resources people I had worked with my whole career. They took me in a room, interrogated me, asked me why I went to the New York Times, why did I come out publicly, what was I doing, and basically said, are you gonna walk out quietly, or are we gonna walk you out? And
Wow.
I just said, you people are all insane. Like, I cannot believe you're doing this. Like, so
Well, when
they walked
people
me out of
saw
the
you being
hospital.
treated like that, I'm sure that just made sure that they kept their mouth shut.
Oh yeah. Yeah. And I was holding a valid, approved religious exemption at the time. The mandates didn't come down for people holding approved religious exemptions for a month after that. So I was the only person fired that day, and I was fired by being walked out. People who were holding religious exemptions in the end of November were allowed to complete their shift, and then that night it was their last night, and they knew it. It wasn't like they were thrown out of the hospital at
So
some
they
random
didn't,
date.
they weren't
Um,
even allowed, even with a religious exemption, that you couldn't get out of it, nothing?
Not in New York, not in New York.
Oh,
So
that's
the
right. You're in New
November
York.
22nd, I think, was the final day that now hospitals that had unions had a little bit longer after that. My sister was a nurse at a union hospital. So, but for your regular run of the mill, like routine hospitals, believe it was November 22nd was the last day they could work with an approved religious exemption. So technically, I should have been able to work to the end of November. But the hospital used the excuse that because I wasn't going to get vaccinated, they just got rid of me sooner. Really? Well, then why didn't they get rid of all the other people? They didn't. It was just me. And it was, again, because I whistle blew and I went
Right.
public in this whole thing. So that was the end of my career,
And
basically. That was the day they canceled me. And then a newspaper article came up in our local newspaper about what happened and how, basically I was crazy and I'm seeing all these things and nobody sees it. And so basically they just, made me out to be some crazy person, and that was that.
wow, that must,
So ultimately, it took me, well, almost 2 years to find, no, it took me a year to find Warner Mendenhall. After that, right, I had all this evidence. I was collecting evidence from the moment I started this project back in January of 2021, and I was fired October 6th. I had all this evidence, and I said, I need to get to an attorney. I need to, because Aaron's firm at the time, they didn't have a false claims attorney in the firm. So there really
right.
wasn't anything that they could directly do after I was fired. So I was kind of left to figure out where do I go with all this evidence? What do I do? And I just kept calling attorneys' offices. I couldn't get past, the person on the line. Nobody
Right.
wanted to
Anything to
talk.
do with COVID vaccines.
Oh,
Nope.
they wanted nothing to do with it. So I started, again, watching groups and things online. And Steve Kirsch and I became, close. I had done a couple shows with him. And I was watching one of his Vaccine Safety Research Foundation shows, and Warner Mendenhall was on there with Mr. Barnes and Brooke Jackson talking about the Brooke Jackson case. And I said to myself, this guy seems like a pretty smart guy. He seems like somebody that might be willing to listen to me. There was something that I felt that I just connected to him. And I said,
Right.
I'm going to reach out to him. So I emailed him. I told him what went on with me, what evidence I had. And he called me and he said, Deb, we talked for a while on the phone, and we really didn't have a theory of how we could go about this, but he basically needed something that would directly connect the hospital to kind of a crime of sorts.
Mm-hmm.
And I happened to have that document, and that was the program participation agreement,
Mm-hmm.
which again, like I referred to
Oh,
earlier, that is an agreement that every facility, every pharmacy, every clinic that gave out a COVID vaccine signed an agreement with the CDC and the FDA that said, as a condition of payment, they will assure VAERS
wow.
reporting gets done, and they will educate everyone in the system that this had to be done. This was one, I believe it was number 9 or number 10 in the requirements of this agreement. And people can look it up online. They just have to Google CDC VAERS program participation, or CDC COVID vaccine program participation
Right.
agreement, and you can download it online. So that was the clincher, because in it said they're a material condition of payment. The
Right.
reporting to VAERS is a material condition of payment based on the False Claims Act, which is how we came about this lawsuit. And the whole idea behind the lawsuit is that for every patient that, let's say, Rochester Regional Health gave a vaccine to, a COVID vaccine to, And then that patient got admitted or was seen in the ER afterwards in a Rochester Regional Health Facility for a reportable event. If a VAERS report was not filed, that's a false claim, right? Based on the agreement.
Right.
And
Right.
the judge agreed with us. We had our hearing in June, and we survived the motion to dismiss. So the judge,
June of just like 2 months ago, June?
yeah, just 2 months ago.
Okay.
So we survived the motion to dismiss, and we're moving the case into discovery. And it is based on that fact that as a vaccination center, they billed for those COVID vaccines that they administered. So then they, under that program participation agreement, were required by law to report to VAERS.
Okay, so
the EUA.
what's the chance that the hospital, because obviously, in discovery, you should be able to go in and check all this. What's the potential that the hospital is going to just try to cover all that up? Like, I don't know, mess with their records so that.
Well, I mean, I have patients, right? I have patients that were vaccinated at a Rochester Regional Health Facility and came back for services. So we know it happened.
Okay.
Right? We know it happened. Because there are close to 200 patients I wasn't allowed to report on, right? So we know. So that's part of discovery is asking for all the vaccine records.
Wow, you are well equipped here. Would that include
and the judge?
I'm sorry, go ahead. No, what did the judge say?
No, the judge also said they will be required to, because it's also required by law that you have to keep vaccination records of every patient you administer a vaccine to.
Well, what was interesting to me is something that I heard you say in another interview where, you know how everybody's reporting, oh, it's only the unvaccinated that show up in the hospitals. And you're like, that was not true, because like the file might say they were unvaccinated, but if you ask the patient, they actually were vaccinated because they got vaccinated at CVS or Walgreens or something like that. So that's very convoluted too. Like there were never correct numbers on the whole vaccine unvaccinated status of people.
Oh, not at all. I mean, people have to remember each hospital has their own electronic health record, EHR, and we used Epic. And so like the local Walgreens or Rite Aid or CVS, they're not on Epic, right? So, and that's where a lot of people would get vaccinated, or at these drive-by clinics, funded by the health departments or whatever. So, I mean, so those vaccines, they're not being recorded in the Epic system. So when a patient then would get admitted to our facility, which has
it would show that they're unvaccinated.
It's not there. It would show they're unvaccinated unless the admitting nurse asks, "Did you get a COVID vaccine?" and then uploads it into our Epic system. It's not there. It lists them as vaccine unknown, and the vaccine unknown went along with the unvaccinated. So that's how
you shared an example of like in one day there were 35 people after the vaccine rolled out. There were like 35 people in the ER or something. And
it was the ICU. Every single patient in the ICU that day, and I have the records to prove it, every patient in our ICU was a vaccinated patient. Now, they weren't in there just for COVID. I try to make people understand that. These were people that were in the hospital for other reasons, of pneumonia or whatever else. But isn't that interesting? Because at the time, we only had maybe a 45 or 50% vaccination rate in our county.
Wow.
But every patient in the ICU received a COVID vaccine? That's weird, right? Wouldn't you think there'd be some unvaccinated people there? It seems like, at least what I was observing, people who were getting COVID vaccines seem to get sick more, right? They're not as healthy as, again, this is supposed to be keeping us healthy. Well, they're not keeping us healthy. In fact, it was just an observation.
If we could do some research on this, I mean, the NIH certainly has, and I have spoken to Jay Bhattacharya before he became the NIH director. I had conversations with him. I mean, he knows all about the vaccine injured, and there are, I mean, React 19 could hand over thousands, tens of thousands of people for them to study. And it's, we just don't know what's going on behind the scenes. But your lawsuit, has anybody filed such a lawsuit like this before?
Nope. We're the first in history. We're the first in history to ever try to hold an organization accountable for not reporting to VAERS.
Is this going to go in front of a jury?
Yeah, ultimately that's our goal. We asked for a jury trial. Yeah, we have another hurdle to get through. We have one more hurdle, and that's the summary judgment hurdle. But that's down the road about 6 months or so. But I mean, yes, that's our ultimate goal. Is I want to see policy change, right? Because it comes down to just it's common sense, I guess, right? Again, if you Google right now, what does the United States use to monitor vaccine safety? They talk about VAERS. Okay. Well, you would always say that's a voluntary system, right? Is it? It's a voluntary system if you're maybe a patient, but
right.
There are required reporting. For regular vaccines, we have the table of reportable events, which is required reporting.
Right.
For healthcare workers, it's the same thing like it was with the emergency use. For healthcare workers, there are specific reporting requirements because, again, we're the ones observing these patients, and we can best kind of sort out stuff. Patients can always file a report themselves,
right?
But for the healthcare workers, there were specific requirements under the emergency use specifically.
And it even says that if you file a false report, there's a fine. Yeah, it's a crime.
Right, so there's a fine. I mean, so what? Because they say, oh, we don't know that these things are real. Anybody can file. Really?
And some weird. I mean, filing? You can find some statistical outlier where somebody does something goofy or whatever, but sure. That's the majority of people that the majority that are filed are truly filed. And again, it doesn't absolutely lead to causation. But when you see enough correlation,
yes.
Like, okay, we now have 35,000 deaths in the VAERS reporting system.
Within a day, right?
Within a day. Maybe we should look at that. And, and we've also seen all of the, the studies that have shown that VAERS is so underreported that, less than 1% even get reported, which you had said something in one of your interviews that you had gotten callbacks right away from the CDC. They took this very seriously. And I have to tell you, those people that recorded it, maybe it's different for a medical professional, but for those people who reported it, like Danny, like Joel, nothing, never heard back from CDC.
And
nothing.
It's hard to say.
Or their VAERS reports disappeared.
Yeah, I've heard that. And maybe it's because it was me. Yeah. Maybe because I was making waves. One of the other things that I did through this is I was very, I talked with Moderna. So Moderna had their own, because again, the vaccine manufacturers are also required by law. If any,
none of them will talk to the vaccine injured.
Yeah, if any vaccine side effects come to their attention, they are also required by law to report this. And I knew that. So I contacted every one of the vaccine manufacturers, Johnson & Johnson, Pfizer, and Moderna. And I tried to get to who in their company is responsible for vaccine safety. The only company I could get a hold of anybody who took it seriously was Moderna. And so Moderna, every single Moderna patient that I filed a VAERS report on, Moderna knows about it. They knew because I faxed those reports to the Moderna vaccine safety person. Pfizer basically wanted nothing to do with me. J&J, I couldn't even get a hold of anybody. So I went that extra step. I mean, this was something I had no belief that anybody was doing anything nefariously. I truly
you just thought, okay, I'm just going to let people know what's happening. That's like all the vaccine injured. They just thought, hey, we're just going to let people know. And once people know, the right thing will be done. Nope.
No. And slowly I began to realize no one wants the right thing to be done. And that was a very scary time for me. And it still is, because that's why I think I'm so passionate about taking this to the end, right? Whatever the end result will be with this lawsuit, I hope it leads to Washington to policy change. I'd love to meet with Bobby Kennedy. I would love to meet with him. and talk to him about the experiences that I've had and the policy changes that need to take place in order to restore the integrity of our vaccination system, our healthcare workers' faith in our professions. Do they understand how many healthcare workers are leaving our healthcare professions in droves because of what happened in the pandemic? We are at a crisis in healthcare for so many reasons, and it's because no one trusts the agencies that were there to supposedly protect us. And if we truly want to restore our trust, they need to talk to me.
I would feel, what? If you were put in charge, if you were put in charge of the VAERS, I'd be like, okay, I can trust it now. Just given your history and your commitment, they need someone exactly like you.
Why have a program and why tell the American people that this is going to keep you safe if then you're going to allow people to be fired over reporting to your system? Who's going to report now? After what happened to me, tell me, why would anybody file a VAERS report? It's going nowhere. Nobody's listening to you. You're going to possibly get fired and be called an anti-vaxxer, destroyed on social media. Why would anybody, and you're not going to get paid, by the way, not that that's the main motivation, but come on, you're spending an hour a report and it's deleting you. It's knocking out your file. It's embarrassing, right? This is our government system and our computer system, the VAERS report, it times out, and it's almost purposeful that it makes it so hard. It's embarrassing. You know what I mean? We need change. This is ridiculous.
Well, and hopefully your lawsuit will do that. So what's the next timeline? Like so you're in discovery. When will we see, summary judgment? When is that kind of scheduled?
Probably around December timeframe. December, maybe early January will be when we'll be in that summary judgment. We've got we'll have about 90 days of the discovery, getting evidence, collecting evidence from both sides, and then we'll have about 90 days of depositions, roughly. So that's going to bring us to, December, January timeframe.
Okay, so this is obviously a very costly venture, but it is certainly one that every single one of us will benefit from. And so yes. Where can people go to support you, to read about the case? And not by support you, by supporting your case, we are supporting ourselves. You know what I'm saying? It's Absolutely. Like, I want to give to this because I'm gonna hopefully bear fruit from this investment.
Right. People have to understand. I'm just a regular person. I live in a small town. I was just a regular person like everyone else, going about my job every day. And then I got thrown into this nightmare, and I will see it to the end. No matter if I have to sell my home, I don't care. I'm going to see it to the end because it means so much to me personally. And through this whole process, I have met so many injured people. I have so many injured people in my community. The patients that I couldn't file those reports to, it devastates me, right? I feel they've been left behind because their story was never told, right? Like all those people that I couldn't report to, their stories are never told, right? Because they didn't know I was even there to support them because my hospital shut me down. So, that's part of my passion too, right? Is I feel they got jilted out of their own story, their ability to tell their loved one's story.
So people should go to, what is it?
IamDebConrad.com is our website.
And I'll put that in the show notes so people can click on that link.
And there is a donate button for people to help us fund this lawsuit. It is unbelievably expensive to get this thing to trial. People just don't understand. And everybody's like, oh, the attorney will pay for it. Warner can't.
Warner has so many.
Warner has so much, and he takes these cases on contingency. And where does he get the money to file all the documents, right? It's like, It is, people have to understand these are not cases anybody wants, right?
Right.
These are not,
people are in this because of people are in this because of the principle. They're in this because like it's costing people everything they have, but it's like this is, and I guess so if you were going to be
Yeah.
written in the history books, like if someday, this is all going to be put out and put out there, and what would Deb Conrad want to be known for as if somebody's writing something in a history book about this woman who, pursued this lawsuit, losing her job, risking everything. What would you like your legacy to be?
Courage, faith, for sure. And to stand up for what you truly believe in. Because if you say you believe in something and you stand for something, someday you might get tested. And are you really going to be that person you claim to be? Or are you going to cower away in fear? So I, for one, I stood for what I believed in. And I can say through my entire life, anybody who knows me, they're not shocked I did this. This is what I've done my whole life. Again, so for anybody that can sit there and be like, oh, she's just making this up, ask
Oh, no.
anybody who knows me. This is what I've done my whole life, and I didn't do anything different, only this was a different time, a different whatever motive they had with this vaccine and all of this shenanigans that went on. And for standing up for what I've always believed in and what I've always done, I lost everything, right? But I don't care because I really don't. I mean, was I afraid? Of course I was afraid. I was afraid of what was going to happen. I mean, I was going to lose everything. I mean, nobody wants that, but at the same time, I couldn't live with myself. And to me, what you stand for means more than you can't put a price on that. I don't
Right.
care. I would have been homeless if I had to been. And I say that to this day. I mean, I don't care. This is that hill you die on, kind of, so to speak.
And that's why
I don't
we
know.
need you in charge of the VAERS reporting system.
Oh, I'd love to.
Honestly.
Trust me. I mean, I truly think I'm probably the person in the United States who has filed the most VAERS reports. I
You're
truly think
probably, I
I mean,
probably,
I can't imagine. Maybe there's somebody else who's filed more, but I highly doubt it. I really
I
do.
think there's a lot of people who, are bringing attention to this. I work with Ashley Grogg for Hoosiers for Medical Liberty, and she came
Yes.
out with a whole VAERS education, how to file. She put together this whole educational program. I'll have to send it to you. So I
I
know
actually
she's,
know Ashley, and I
oh,
talked to her and I said, this is amazing. This is what health systems should enact. They should take this
yes,
and run with it. This is the perfect way to educate your staff on the
yes.
importance of vaccine safety.
So
But
yeah, you
nobody
and
wants to talk to Ashley,
yeah,
right? You can't
exactly.
talk about vaccine safety. You can talk about drug safety. You can't talk about that's a whole nother discussion, but it's awful, right?
Well,
It's just
I thank you so much for standing because what you're doing is going to bring, well, hopefully bring help and healing
yes,
and safety to the country in the sense, I mean, to just tens of millions of people, because if we can, if we lose the trust, which we have, people
mm-hmm.
are going to suffer. But if we can bring that trust back, which is your goal, that will
Mm-hmm.
bring a much needed perspective back into the medical community. And
Yep,
so people
absolutely.
can go to iamdebconrad.com, read all about it. We could talk for over an hour, more than that. We're already past an hour, I think. But I mean, all the things that you saw, all the different injuries. I mean, it is profound. Is there any final thing that you'd like to wrap up to say or
One thing I was thinking when you were talking, I was thinking, to me, if vaccines are truly safe, the COVID vaccines are truly safe, everything is safe like we're being told, why then isn't there, why not then suppress me, right? Why
right,
suppress people like me? What is the
right,
fear of allowing healthcare providers to know about VAERS, be educated about VAERS, and report to VAERS? If this is the system that assures the American people that we are safe from vaccines, that they're safe products, then why the problem? Why don't we get taught about this stuff?
right.
You know what I mean? I guess that's the question that I've always had.
And then
You know,
why give vaccine manufacturers complete immunity
Exactly.
to this. I mean, the whole thing smells bad. You know what I'm saying? It's just
It
like, oh
does.
wait, no, we're going to shut you down if you report it, and we're not. And if you get injured, you're not going to get any help. And it's educating people. It's educating
Yes, it
people.
makes no
Like
sense, right? It makes absolutely no
X
sense. And
and mo
it's funny. I have a bumper sticker on my car, and actually, all two. My husband's got this like little beater car that he drives all over the city. All of them have the React 19 make vaccine manufacturers liable. I've got a coffee cup at my job. I mean, everywhere I go, I wear
you
that
know,
proudly.
and that's the goal of React 19. It's just obviously to bring help to the injured, but the goal is safety. You
Yes, and
know,
awareness. Exactly.
again, turning, Joel always says, Joel and Bree both always say, turning our negative reactions into positive actions. Okay,
Mhm.
there were, there's so much that went wrong here. Can we at least examine this and turn it into positive actions moving forward for
Mhm.
everyone? For everyone, right?
Absolutely.
Right now, you and I both know that there are people languishing in their beds with no hope of ever getting help because their government won't acknowledge them, the manufacturers won't acknowledge them. They have exhausted every potential way of getting help. They've used up their entire life savings. Some have had to leave their homes. That's that's where we are, and it must change. It
It must
absolutely must
change.
change. And
Because
we're
if we
gonna,
don't change it, trust is going to erode even further,
yeah, and then we're
right?
gonna
It's
have
going to
real
erode
problems.
even further because
All
these
right.
are people's families. There and remember, there's every single person I think if you talk to, they know someone who's vaccine
Oh,
injured.
absolutely. Absolutely. We had a very tragic situation here locally that a
Mm.
doctor that everybody loved, a lot of people went to, he got vaccine injured and he committed suicide. And
Oh,
I mean, because where does a doctor go when
where
the
does a
whole
doctor
system
go?
is telling him, be quiet, and then how does he
Oh,
go to his
tragic.
patients? So sad, so sad. And that's why you're here on this earth at this point in history for such a time as this. And people go right now to iamdebconrad.com and invest in your own future by investing into this case. And go there to check out all the updates coming up. And, Deb, I hope you and I can do a follow-up interview about a year from now, and we can say, hey, you won, and you're now the head of VAERS, and we're going to bring trust back to the American people. So anyway, thank you so much for your time today. And yes, we will look forward to the future.
Thank you so much, Anne.